I am Desy Wenas, a lecturer and also researcher from National Institute Science and Technology in Indonesia. So I'm going. My focus research is natural products, finding research, especially for microbiology, antimicrobial, and also for anti-aging, and also some research joining the nanotechnology. I'm also uh, interested in social community and also love to joining and engage with the children's activity, especially for the science experiments for the secondary, for the primary, and also high schools. Um, yeah, I think that is my introductions. So I'm going to present my presentation, my talks about combating the rising threats of AMR, overcoming social barriers of anti-vaccinations to protect children. Okay, so there is a public health emergency in Indonesia, which is stated from disease measles, rubella, and also polio, and also diphtheria in Indonesia. There is outbreaks. There is extraordinary events which is happen in Indonesia. Recently, major outbreaks which is occur in multiple provinces. Some of the places in Indonesia links to the low MR vaccination coverage, while the polio also there is the emergence of polio, which is the disease of brink of eradication, which is signal critically failure in routine immunization. And for the DT, diphtheria, cases have also declared extraordinary event overwhelming health systems. The consequences of hesitance here is there's a two main point, the refusal. Despite the clear and present danger, a significant portion of the population refuses routine childhood vaccination, but not primarily in issue of access, but also acceptance. The second one, the reactive cost. This refusal forces the government into costly and reactive measures, diverting large-scale funds to mass vaccination campaign to manage outbreak. The vaccinations actually is very critical to prevent AMR because it can prevent initial infection. It can stop bacterial and viral infection from started. The second one, it can reduce antibiotics use. Fewer infection means fewer antibiotic or prescribes. This also especially true for the viral infections where antibiotics are often misused just in case. The slow resistance. This reduced usage is the most critical way to slow down MR. When antibiotics are used less, the bacteria will have fewer opportunity to evolve and become resistant. So I'm going to show some of uh, the real cases. So there is the outbreaks in Indonesia of MR, polio, and diphtheria. So start from 2017, there is outbreaks of diphtheria occurred in several regions in Indonesia. This is, I got it from the news. In Indonesia, there is 46 regions in Indonesia report measles outbreaks. So there are at least 23,000 suspected measles cases throughout 2025. And then there is from 20,000 samples confirmed 3,000 positive cases of measles. In here, there is a news about a government campaign programs to vaccinations measles after 17 children dies because of the outbreaks. And this is another news about the extraordinary cases of polio in Indonesia, which is uh, there. Indonesia once announced as free of polio, but started 2022. There is a patient, 7 years old child in Aceh, PD region, experienced symptoms of paralysis in his left leg. And then there's no history contact with the virus or travel abroad. So, but from that event, it become uh, continue to the effect to other cases, such as in 2024, there is 3 children in Java and also Central Java, and also which is suffering the acute flaccid paralysis caused by the poliovirus type 2. And then the Ministry of Health do the make the program immunizations. So um, as I mentioned before, the first case start from the 2022 November in Aceh, and also it will emerge. And then 2024 there is another cases. So the primary cause of these outbreaks because there's a failure to achieve the herd immunity due to the vaccine refusals. Some of the causes, the sequences, the government is forced to allocate significant funds and resources for emergency mass vaccination program. So I will mention some of the social barriers associated with this. There is a concern about non-halal, status about vaccine component, which is very sensitive in Indonesia because Indonesia has the main religion concerning about this. And then the second one, there is a rumors about microchips that's spreading in the social media. There is microchips incorporated in the vaccination solution and etc. This will leading the deep institutional distrust and also refusal. And then the third one, lack of trust. Well, by generally distrust in government and also health professional, it will amplify the negative experience. So immunization in Indonesia for children, it is a must. It's a compulsory for 12 until 59 months. But according to this study, not only distrust, not only about sensitive issue about not halal, but there is also a factor from social economy. So the social economic factors strongly associated with the likelihood being unimmunized. While the Indonesia area is very geographical cluster and most of them has most deprived populations and some of them also has difficulty to reach and get the immunization. So this is the articles about uh, understanding of influence, religious and safety concern in childhood measles and also pertussis vaccinations. This and then what is the impact and government response? So the extraordinary cases is implemented to increase the attention and also take rapid actions in affected and high-risk area. For the mass immunization, government is conduct mass immunization for children in area which is vulnerable, including Aceh and also West Java. And then need active surveillance effort to carry out to detect cases, detect the paralysis and monitor the spread of the virus. So vaccination. Vaccination is a child's fundamental right. There is a right to health under the UN Convention on the Right of the Child. Every child has the right to the highest attainable standard of health. Vaccination is one of the most effective intervention to ensure this right. So it's the duty of the state and also society to ensure an environment where all the children receive this protection. So again, I emphasize the roles of vaccination to in preventing antimicrobial resistance. So the AMR occur when the microbe evolve, making the drugs like antibiotics ineffective and turning common infection deadly. the primary cause here, the overuse and misuse of antibiotic often to treat secondary infections that could have been prevented. Some cases, not all, some doctor can prescribe antibiotics even though the patients has the diagnosis caused by the virus. But the reason, some of the reason is like giving the antibiotic to reduce the infection caused by the bacteria. But still, the cause of the infections is still made of by the virus. The second role here, vaccine can break the chain by preventing the primary infection, which is polio, diphtheria, influenza. Vaccination can drastically reduce the need of antibiotics treatment. The impact here, this will reduce antibiotic demand, directly slow down the evolutions of drug-resistant bacteria. So vaccine are the critical first line of defense against AMR. What are the strategies and actionable steps? So we need to listen first. We have to validate parental concerns about their children, the safety of their children, especially about the halal and also maybe the rumors, microchip incorporated in the vaccination solution rather than immediate dismissal. The second, local credibility, utilize pediatrician, religious leader, community elders as trusted vaccine ambassador. And then the third one, pre-bunking, which is proactively educate the public on the tactic of disinformation, not just debunking the individual myth. So there is a four big strategies for change. We need to engage the leader, and we can engage the men and the fathers. So not only the women's responsibility to uh, take care of the child. The third, targeted communications. So we have to use the local dialects and trusted platform to actively encounter the hoaxes with clear, simple, empathetic facts. The fourth one, we have to empower health worker. We have to train local midwives. In Indonesia, we call it bidan. And also, we have to train the smaller health posts, which usually in Indonesia, we use puskesmas to reach out the health facility in very area which is very far from the main city, or maybe from the main or the general hospital, the big general hospital. So the staff of puskesmas also need to patiently listen and to address the specific parental concern. So step one, strengthen the regulation and transparency. We need to increase the transparency and accessibility of halal and safety and certification from BPOM. BPOM is a national agency of drug and food control in Indonesia to build confidence. Second, we need to increase the public digital literacy by launching the national programs to educate the public, especially parents, on how to identify and report false or misleading health content on digital platform. Second, by intervene, we have to make intervention about the community. So focus on the long-term educations. We need to mobilize key leaders, actively involve religious and cultural leaders in vaccinations campaign as respected cultural action authorities. Second, early AMR educations. We can integrate materials in infections prevention and also danger of AMR into primary, secondary, and also high school curricula. Maybe incorporate in their experiment, science project, or maybe their social community services experiment and others. Third, flexibility services. Provide more accessibility and convenient schedule vaccination services, especially for the family in remote and underserved area. To stop the spread of disease like polio and MR, we must achieve minimum 95% vaccination coverage. This will ensure the population has robust collection protection. And then by achieving this figure on national and subnational level is the key to prevent future outbreaks and guarantee the health rights of Indonesia children. for the end of my presentation. Protect our children, secure our future. The fight against AMR begins with the vaccinations. Thank you, and I give it back to the moderator.